intermittent fasting has gained popularity because many people think it's a good way to lose weight.
But a new data just released by the American Heart Association shows that people who intermittent fast increase their risk of dying from cardiovascular disease by about 91%. That's shocking. Joining us in studio now to speak more about these findings is Dr. Sanjay Bojraj. Did I get that right?
Perfect.
Pretty close. Okay, you're the cardiologist and founder of Well12 Health. Thank you so much for being here. First question for people who don't know, let's start with intermittent fasting. Is it just don't eat for a week, don't do anything? No, what is it?
Yeah, I think a week would be a little bit extreme, but at its basic, it involves eating during a certain period of time and not eating during a certain period of time. So most people can start out with 12 hours of eating and 12 hours of not eating, and ideally get to a place where you're eating within an 8-hour window and fasting for 16 hours.
But I'm hungry like all the time.
Well, oddly, your body gets accustomed to this, and the reason it's important is that 16 hours of fasting actually helps your body use the fuel that you already have. So rather than keep feeding the beast, you're able to use the fuel, and that really is the way your body is designed to work.
Oh, that's interesting. So the abstract put up by the American Heart Association looked at more than 20,000 Americans over 15 years. Can you tell us some of those findings?
Yeah, absolutely. I woke up just like everybody and was absolutely terrified when I saw that 91% risk, and I had my inbox flooded with people of concern. But what we have to do is look beyond the headline and look a little bit closer at the study. So in that study, they took 2 surveys of people from that data set, and they had to remember what they ate and when they ate. So think about the last time you were at the dentist and they ask you how many times you floss. You probably want to answer in a way that pleases them. So similarly, when we rely on recall data, it's not always so reliable. And even on top of that is that the question is 2 days of fasting really enough to lead to a 91% change in any health parameter?
I think you've already sort of pointed this out, but what are some of the problems that you're talking about here with this particular abstract?
Yeah, so first of all, an abstract is not peer reviewed, so it's very early science, and I credit the authors for trying to look at this and really bringing intermittent fasting to the forefront as something that we're talking about. I think some of the other concerns are that we don't know much about the participants in the study. In fact, what little we do know suggests that the people who were in that 8-hour eating window were more sick than their counterparts. For instance, they had a 27% incidence of smokers in that group, whereas the other groups were more representative of the United States in like 10 to 15%. So it may have just been a sicker population of patients in that group.
Now, what are the real benefits and risk of intermittent fasting?
Yeah, so I've been preaching intermittent fasting for years, and one of the things I like about it most is it really helps people optimize their metabolic health. What does that mean? Well, it helps your body work better, it helps you use the fuel that you have better, and it helps you utilize glucose in a way that your body is supposed to really optimize generating energy so that you don't have to take a nap in the middle of the day, so you can just get from morning to night more smoothly.
So what's your advice? I mean, go ahead and do it if you do it right, I guess. Right?
Yeah, so I would, as with anything, talk to your doctor, talk to your healthcare team, make sure that it's right for you, because there are some people that it doesn't work for. But if you are a candidate, I think it's a very easy way and a relatively inexpensive way to really get a lot of bang for your buck to optimize your health.
Now, what's the best way for people to feel healthier, lose weight? Is this fasting for everybody?
Well, fasting's not for everybody, but I think it's for a lot of people. And I think, unfortunately, most people think I need to exercise more, I need to do more to lose weight. And really what we've learned is that exercise and energy expenditure is really just a small percentage of the equation of weight loss. We really need to focus on what we're putting in our body, what we're fueling ourselves with to get an optimal benefit.
Yeah, so it's really that 20% gym, 80% in the kitchen, right?
You can't outrun a bad diet. That's what my triathlon coach told me.
Love that.
All right, thank you so much, Dr. Bojraj, for joining us here today.
It's been great. Thanks so much for having me.